In as much as I'm an advocate for going to conventional medicine, using, going to the hospital instead of visiting traditionalists, but I can't also deny the reality on ground that many Nigerians cannot actually afford medical care, going to the hospital. Many Nigerians can only afford going to the traditionalist, and that is the reality on ground. For example, if you go to many hospitals today, okay, let's even say government has subsidized physiotherapy charges, but how many people can really afford physiotherapy for real? For real, I had to ask myself that question. I said, what? How many people earn above 200,000 naira a month in Nigeria? And I asked myself, how much does a physiotherapist charge per home visit in Nigeria? Most Nigerians cannot afford home visit physiotherapy. They are left with one option: go to the hospital. So in the hospital, government would have subsidized physiotherapy charges. Very good, good and fine. However, you realize, like now, these Nigerian hospitals, the equipment, this one spoiled, this one spoiled, it's crazy. And then there are too many people. When I was working in one military hospital as a physiotherapist, the number of patients we saw every day were like, how many were we? We are seeing up for something patients because the charges there were subsidized. Even the kind of subsidized charges were actually not, some people couldn't still afford it. A private soldier was telling me that his pay was 50,000 naira at the time. 50,000 naira take home. And this guy was coming from Ogun State to Lagos. How was this guy supposed to bring out money from that 50,000 naira, feed his family? Well, government has given them accommodation, quite all right, but feed his family, cater for other needs, and then still bring out money to take physiotherapy. You know, fares. They had insurance, quite all right, which was actually his saving grace, which was why he was able to come for physiotherapy. Leading me to the next point. The only way around it is insurance. Insurance, but sadly, we are not there yet with regards to insurance. Insurance in Nigeria is still a far fetched call. Some of the insurance can't even cover basic things. You say physiotherapy, you're telling a patient they need like 3 or 4 sessions of physiotherapy every week, but their insurance is saying we can only pay for two. That's for those that can even afford insurance. It doesn't reflect the majority of Nigerians currently, and it's a real challenge, I must say.